Meanwhile, members of the Karnataka Union of ASHA workers affiliated to the All India United Trade Union Centre from across the state are protesting at Freedom Park. Apart from a fixed monthly honorarium, ASHA workers are also demanding an increase of 2,000 rupees for city-based workers, which they say is mandatory to meet the higher cost of living in urban areas. Another key demand is the withdrawal of an official memorandum that was issued in November 28th of last year, which mandates that ASHA workers are supposed to use smartphones for their tasks. The strike is expected to disrupt critical immunization sessions. My colleague Sudha Sadanand in fact joins us on the phone line on this particular issue. 42,000 ASHA workers going on protest. It's actually going to disrupt a lot of healthcare policies as well as schemes if they continue with this protest. Isn't it, Sudha?
Yeah, Varghese, the thing is that these ASHA workers, ASHA is an acronym for Accredited Social Health Activists. They are a crucial link. They bridge the gap between people and the healthcare system, and especially in rural areas. And, Varghese, they're called as volunteers, but they are actually the backbone of several government campaigns. Now, these workers cover immunization, maternal health, sanitation, and disease prevention. And like you said, that 42,000, if they are sitting on strike at Freedom Park, it means that the healthcare, it's not as if healthcare only happens in a season. It's in every day, it's every second that is unfolding. It's going to be severely impacted. And I think this strike, which they spoke about, Varghese, for some weeks now, saying, please give us what we are demanding or else we will sit on a strike. I think the day came when they said that, okay, this is the time for us to sit and protest. And also the point is, I think more than, not to look at it as a strike. Of course, strike is a fundamental right for all of us workers. But the point is that it's more about dignity. It's more about recognition of work that they do. They are medical soldiers, as it were, Varghese.
Also, so the big impact is that, as you were rightly pointing about, it's not only about vaccination and other things. It's also about TB. To control TB, a huge effort is played by ASHA workers in rural areas. So this strike, in fact, does affect those programs as well, because most of the time they're focused on the immunization of children, but they also take up these big campaigns as well.
They do, absolutely right. And what is really sad is that because they are called volunteers and they do so much of important, significant work, the compensation that they get, Varghese, is based on task-based incentives. If you do a task, then they are paid for the work they do. There is no fixed salary as such. And, I think that is what something that they are asking, that, at least pay us a fixed monthly honorarium of 15,000 rupees with an additional 2,000 for urban ASHA workers, because the cost of living in urban areas in Karnataka, much like other metropolises across India, is very steep. And using of smartphones, imagine that they do not get paid a fixed salary, they only get incentives. And on top of that, they also have to buy a smartphone, which is rather expensive, both to maintain as well as to buy. So I think it's absolutely legit what they want, and you're absolutely right. Apart from immunization and, of course, looking at all the maternal needs of women and also other ailments like diarrhea, for instance, Varghese, which strikes rural areas of this country often because of polluted water. There is no potable water in many areas. The ASHA workers are the ones who are saving lives. So therefore, I think their strike is legitimate and they're demanding. Let's see what the government does going forward.